Hello, and welcome to this episode of the Asthma Spotlight podcast. In some people, there are particular things that can cause or spark off an asthma attack, and these are called triggers or trigger factors, and that's the topic I'm going to focus on in this podcast episode. Ideally, you should be able to identify and remember those things that trigger or make your own asthma worse, so that you can avoid them if possible. Common triggers of asthma attacks include animal dander, for example, from exposure to animals like cats or dogs or horses, pollen, for example, grass or tree pollen. Tree pollen occurs in the spring when the trees start blossoming, and grass pollen is a problem in the summer. Molds in the autumn or the fall can also trigger asthma flare-ups. Now, other triggers include some foods, exposure to dust, smoke, fumes, and even some medicines like antibiotics like penicillin, and some medicines that are used for pain, and some that are used for treating eye and heart conditions and blood pressure. So you should be aware of what triggers your asthma attacks. The problem with the triggers is that they can occur at any time and without any warning. And so after your asthma has been diagnosed, you may not know what your trigger factors are, and exposure to them could spark off an asthma attack, as I say, without much warning. So you do need to try and find out what causes your asthma to flare up, and these are your own particular trigger factors. Sometimes the clues to your triggers are quite obvious. For example, if your asthma is always worse in the springtime, you're possibly allergic to tree pollen. If it's worse in the summer, especially if you've been outdoors and been in an area where grass has recently been cut, then you're probably allergic to grass pollen. If your asthma is bad all year round, then you may be allergic to the house dust mite that lives in all of our homes. And these are tiny little insects that live in pillows and mattresses. If you are allergic to tree or grass pollen or to house dust mites, then in addition to asthma, you may suffer from another disease called allergic rhinitis. And this is a condition that makes your nose runny and itchy when you're exposed to pollens or molds or house dust mites. Sometimes your eyes are also affected and runny or itchy, and that's called allergic conjunctivitis. So why am I telling you about allergic rhinitis and allergic conjunctivitis? It's because allergic rhinitis and allergic conjunctivitis, which has not been treated or which is uncontrolled, can trigger off asthma attacks or be responsible for poor asthma control. So if you notice that you have symptoms of allergy in your nose or eyes, that's itching or runny nose or eyes, perhaps after exposure to pollens or dusts or molds, and you feel that your asthma is out of control when this happens, then ask your doctor for advice on treating this condition, because by controlling the allergic rhinitis or conjunctivitis properly with medication, it may help to improve your asthma control. One of the things that your doctor would think of if your asthma is out of control is whether you have another condition that's triggering your asthma, and allergic rhinitis is one of those common conditions. So if that's treated, your asthma control should improve. Animal triggers of asthma are fairly common, and these include cats, dogs, horses, and other animals. And exposure to these may trigger off asthma attacks. So if you know you're going to be near animals that make your asthma worse, you should make sure you're taking your usual preventer medication and any extra medication that your doctor has advised. Ideally, you should avoid contact with animals that trigger your asthma. However, we all know this may not be possible. And if it's not possible to avoid contact, then you need to make sure that your asthma control and medication, as advised by your doctor, is taken regularly. Virus infections are common and important triggers of asthma attacks. Now, I did speak quite a lot in a previous episode about viral infections in young children. And typically, when you have a virus infection, the symptoms last for a week or two, and then you feel better and you can get on with your life. However, if you have asthma, these viral infections or colds can cause your asthma to flare up, and you could end up having symptoms that go on for many, many weeks. In fact, this is one of the ways that people with asthma or their doctors may first realize that you have a disease that causes your cold symptoms to go on and on. So if you or a family member has not been diagnosed with asthma, but you notice that you have symptoms, coughing, wheezing, or shortness of breath, that continue for longer than a week or so after the infection or cold, you should ask your doctor if you possibly have asthma that hasn't yet been diagnosed. So if you or your child find that colds that go into your chest, or that you or your child cough for many weeks after a cold, ask your doctor if you have possibly got asthma. On the other hand, if you have been diagnosed with asthma and that's been confirmed, viral infections can trigger attacks because the virus sparks off your asthma inflammation, and this does not improve with any of the treatments that you might take for the infection. So the key message is first that you should take your asthma controller treatment to help prevent viral infections from triggering an asthma attack. The treatment won't prevent virus infections, but they will help to prevent those viral infections from sparking off the inflammation due to your asthma, which causes attacks. Secondly, if you do get a cold or a viral infection and your asthma symptoms flare up, you should follow the advice in your asthma self-management plan and call for medical assistance if you're not improving or getting worse. I should say that taking medication for infections, even antibiotics, if you've got a bacterial infection, will not necessarily help improve your asthma. So if you've got an infection that's making your asthma symptoms get worse, that's coughing, wheezing, or shortness of breath, you should follow your asthma self-management plan provided by your doctor and take your asthma medication to try and relieve those symptoms. Now, the reason why most countries in the world advise people with asthma to have a flu vaccine every year is to try and prevent an infection from triggering an attack. And I saw in the news today that we may soon have an immunization or a vaccine against rhinoviruses. And rhinoviruses are one of the common viruses that can spark off asthma attacks. Now, some people suffer from a condition called anaphylaxis, and some people get both asthma and anaphylaxis. Now, the danger for you, if you have both, is that an asthma attack may lead to a severe life-threatening anaphylaxis attack. In anaphylaxis, your immune system causes a severe reaction to certain foods, medicines, insect stings, substances like latex, and other things. So your immune system overreacts and you get a severe allergic reaction affecting many parts of your body. And this disease, anaphylaxis, needs urgent treatment with adrenaline. Anaphylaxis is usually sudden, and usually someone who's been diagnosed and taught how to recognize the symptoms would be able to use their emergency medication or advise somebody how to do that in order to stop the attack from getting worse. So anyone with anaphylaxis would be provided with an emergency action plan and medications to carry along with them, together with clear instructions on how to use these and how to get emergency help. Foods are often the cause or triggers for anaphylaxis, and sometimes this disease can actually be sparked off after exercise, and that's called exercise-induced anaphylaxis. So if you have anaphylaxis, you will have been prescribed medication and advised how and when to use it, and if you start having an allergic reaction, you should use that medication immediately. If you're not sure, then it would help to have an urgent discussion either with your doctor or your specialist nurse. Now, the things that can trigger an anaphylaxis attack can also trigger an asthma attack. And the main difference between asthma and anaphylaxis is that asthma mainly affects the air passages and anaphylaxis affects many parts of the body. Both of these diseases can cause difficulty breathing. However, anaphylaxis can also cause things like itchiness in the skin, vomiting, swelling of the tongue, lips or throat, feeling faint, and a number of other symptoms. Now, as I said, if you have both, an asthma attack may lead on to anaphylaxis, and so you should always have both action plans for asthma anaphylaxis with you and treatment for both at all times. So let's talk about food allergy. A lot of people think they're allergic to foods, and they may or they may not be. Now, foods are sometimes triggers that can make your asthma worse. And there are lots of foods that can cause allergic reactions, and if you have food allergy, you will have been told by your doctor, after having some tests done, what these are and which ones to avoid. I should say that the diagnosis of food allergy can sometimes be difficult, and if you suspect you may have food allergy, you should speak to your doctor about this. Examples of foods that can make asthma worse or that can trigger attacks, and as I said, these can also trigger anaphylaxis attacks in some people. And these are nuts, peanuts, shellfish, some fruit, and all of these things can trigger asthma attacks. There are lots of different foods that trigger asthma, and you should be alerted and notice if you get asthma symptoms during or soon after eating certain foods. In fact, as I said earlier, the first clue that you may have asthma and that you may have a problem is if you suddenly get asthma symptoms, that's symptoms of coughing, wheezing, or shortness of breath after eating certain foods. Typically, if you have an allergy to foods, you get symptoms either while eating or shortly afterwards, and reactions could either be due to asthma or anaphylaxis, as I said before. So if you notice this is happening to you, you should tell your doctor and also request a referral to an allergy specialist to try and find out exactly what the diagnosis is. If you have asthma and you have had an allergic reaction to food, it's really important to have a referral to an allergy clinic. And the reason for this is because the combination of asthma and food allergy could be very dangerous and could lead to a severe asthma attack that could be fatal. A specialist allergy clinic will be able to do some tests and confirm whether you are indeed allergic to some foods, and if so, you may need an emergency pack of medication so that you can take medication while waiting for an ambulance or medical assistance. The pack in this case will include anti-allergy tablets and possibly an adrenaline auto-injector. The adrenaline injector may also be called ephedrine. It's the same drug, it's just got the two different names. If you have been prescribed an emergency allergy treatment pack, you would be taught how to use it. You'd also be taught to carry it and a spare if you've had an injector, and this should be carried with you at all times. You'll be taught how to use the injector, and you should in fact make sure that close family are also instructed how to use it and advised when to use it. So reactions to foods and medicines are not always due to allergy, and that's why a referral to a specialist would be helpful. I mentioned that fruit can cause allergic reactions that could spark off an asthma attack or even anaphylaxis. However, it's not always straightforward. In fact, there's a situation or a condition where you could think you have allergy to some fruit, but this might be caused by another condition that is not dangerous. And this is called oral allergy syndrome. And this happens when you eat uncooked fruit. So if you do get symptoms of itching or irritation in your mouth when you eat uncooked fruit, you should ask your doctor for a referral to an allergy clinic. The specialist will then advise whether you do have an allergy or whether you should just cook fruit before you eat it. Another common asthma trigger I'd like to talk about is exercise. Now, some people find that their asthma gets worse when they do exercise, and this is a very common trigger of asthma. Now, many of you rely on your reliever inhaler before or during exercise when you get these symptoms of asthma. However, you may not realize that asthma symptoms caused by exercise are a sign of poorly controlled asthma, and this can be prevented by taking your preventer inhaler regularly as prescribed by your doctor. And if you do that, you'll find you will not need to use your reliever inhaler before, during, or after exercise, because the preventer or the controller inhaler will help to make sure that you don't get your symptoms when you do exercise. The other trigger I'll mention as a final trigger is laughter. And laughter can often trigger asthma, and in the case of children, this might be a clue that a child has asthma. If a child coughs or wheezes or gets short of breath when they laugh, they may have asthma, and you should ask your doctor whether this is true or not. And as I said, laughter can trigger asthma, and so be aware of this, especially when you're going out with friends. Make sure you've got your reliever inhaler with you so you can do something about it if you do get symptoms. So in summary, the key messages are that there are a number of trigger factors that can spark off asthma attacks. This can happen suddenly without any warning, and so it's important for you to know and to recognize when something has triggered your asthma so that you can take action according to your self-management plan provided by your doctor, and also so that you can avoid exposure to these triggers wherever possible. If you do have particular trigger factors that worsen your asthma, and you know when they're going to happen, like, for example, before the spring trees start blossoming, or before the grass starts blossoming in the summer, make sure that you take your medication, which has been advised, which works against the allergy to these pollens. This is usually an inhaled steroid spray that you use in your nose, as advised by your doctor. And you should start taking this before the pollen starts appearing. So before the spring blossoms and before the summer grass starts growing. So that is, don't wait for the asthma attack before you start taking this anti-allergy medication. Of course, you should also be taking your asthma preventer medication as advised by your doctor to prevent these symptoms. So if you find that your asthma flares up and gets worse when you're exposed to a trigger factor, like exercise or animal dander, your asthma is poorly controlled, and it's a signal that instead of relying on your short-acting reliever inhaler, which is usually blue, you should use your preventer, also called your controller, as prescribed by your doctor to try and prevent these symptoms from flaring up. If this doesn't happen, i.e. if you don't prevent the symptoms and you're taking your preventer medication as advised, then you should discuss this with your doctor, because you might need a different preventer medication, or you might just not be using the inhaler correctly. If you or your child have not been diagnosed with asthma, and you get symptoms of coughing, wheezing, or shortness of breath when exposed to some of the triggers that I mentioned, ask your doctor if you or your child has asthma. That will usually result in a consultation which will involve some tests. You might be given a peak flow meter to take home to see whether your air passages are getting tight at times or not. You might even be prescribed an inhaler as a trial of therapy to see if those symptoms can be prevented. Finally, if you expect to be exposed to a trigger, that's an opportunity to make sure that you take your preventer medication that's been prescribed by your doctor. And of course, if you are going to be in a situation where you'll be exposed to a trigger, make sure you have your own asthma action plan and the medication that goes with it with you when you are in that situation where you are exposed to that trigger.